traditionally um, we were more likely to diagnose people with schizophrenia, and now we really tend to just use that diagnosis for someone that has repeated episodes of psychosis, which is why seeking treatment for one episode is so important, because we know we can help people recover from a first episode of psychosis, and they don't necessarily go on to develop kind of a chronic form of the illness.
I'm Omer. I'm a consultant child and adolescent psychiatrist, which means I work with young people and their family to help them understand what's going on for them and offer some treatment options.
And I'm Alexander. I'm a cognitive behavioural psychotherapist, and I work with young people at risk of developing psychosis or currently experiencing psychosis.
Alex, why do you think there's so much misinformation about psychosis?
So I think there's actually quite a lot of misrepresentation of what psychosis is in the media, and in general. In films, for example, often psychosis and schizophrenia are kind of stereotyped. And I think historically we've not been as good as getting people and the community to understand schizophrenia in the true sense of what it is and what it isn't. A lot of my patients find social media really helpful to find other people their age that are going through similar experiences, and that's great. And communities are created in that way, and people feel understood. On the other hand, we have seen in recent years definitely an increase in misinformation on platforms like TikTok. And in particular, words like schizophrenia and psychosis tend to be misused on a regular basis.
So I suppose it makes you think that you've got to know where you're looking to get the right information.
Yes, exactly. You can't just trust anyone, and you've got to be very careful at whether you're looking at someone talking about their personal experience, which we know is very important, but isn't necessarily can't be generalized to everyone, and whether you're looking at a trusted source, so someone with an actual clinical or academic qualification. One of the misconceptions is, first of all, that hearing a voice equals to being schizophrenic or having psychosis. In reality, we see a lot of people that don't hear voices and have other symptoms that might indicate psychosis. For example, being very suspicious.
Well, I suppose that psychosis involves some of the things that you were talking about in terms of unusual experiences, sensory experience. Maybe you feel something that isn't there, or you hear something or see something that isn't quite there objectively to someone else.
Mm-hmm.
But also it might be thinking about things. Someone's put a thought in my head, or I'm a bit worried that people are trying to get at me,
Yeah.
when there's no evidence for that at all.
Yeah, and I guess psychosis and schizophrenia in general are quite difficult and complex diagnosis to start with, even for professionals. And often we need to do very long and complex assessments.
Yeah, yeah, I agree. And I think that there was even a survey done a long time ago where it was found that I think 20% of people heard some of those voices at one point during the last year. So it's a normal experience, but the question is how often it is, how distressing it is to you, and then what you do about it. If it sort of exercises you quite a lot and you feel quite upset by it and it organizes your life, then it's a problem, right? If you can't do stuff, if it affects your functioning.
Absolutely, and we also think about when and what kind of is preceding these auditory or these voices. So it's not that uncommon for someone that is grieving the loss of a partner, the loss of a parent, to hear their voice, or to see a shadowy figure that reminds them of person that they just lost.
So you're saying that's not psychosis?
So that isn't necessarily psychosis, and we obviously have different tools to try and understand what it is, but that is a normal reaction to grieving.
So it's all about the context and timing, is it?
Absolutely.
Yeah. So I suppose with schizophrenia, and the diagnostic criteria has changed a little bit in terms of thinking about it as a spectrum condition, but you need to have these symptoms ongoing for a month for the diagnosis of schizophrenia. So it's not just a one-off experience, it's something that's happening all the time.
Yes, and it needs to be really distressing, and it needs to be, as you were saying earlier, needs to impact your functioning,
Right.
and it has to be in a context where there isn't a plausible explanation for that phenomena.
There's no other explanation. You haven't taken a illicit substance, for instance, which might have led you to think more along those lines. I think if it happens consistently for more than a month, then that's when we'd call it schizophrenia. Psychosis might be a single or couple of episodes rather than a consistent experience that you have.
Yeah, and actually we, traditionally we were more likely to diagnose people with schizophrenia, and now we really tend to just use that diagnosis for someone that has repeated episodes of psychosis, which is why seeking treatment for one episode is so important, because we know we can help people recover from a first episode of psychosis, and they don't necessarily go on to develop kind of a chronic form of the illness. So, sometimes I see patients that are telling me that they're buying supplements and medication online. What do you think of that?
Well, what I'd say is I'd be really careful about the sources. Where are you buying this? And then secondly, what are you buying? And is it efficacious? Does it have any evidence working on your condition? If you buy medication that should be prescribed, then I'd be very doubtful about it. There are online pharmacies, and as long as they're based in the UK and you have a proper prescription, well, I guess that's fine. That's the modern day work. You don't have to walk into a chemist anymore. But if you're telling me you're going to some site in a different country where there are different regulations and you're buying medication that I would ordinarily prescribe, then I'd be a lot more cautious. We don't know about the regulations, how regulated it is. Is that drug even expired? Is it the proper drug? Are you actually buying the thing you're supposed to buy? There's a particular drug that we sometimes prescribe, like risperidone or aripiprazole, and you take the tablet. Is it actually risperidone? How do you know? And we have such tight regulation around pharmaceuticals, that if you get it from a regulated pharmacy, then you know what's in the tablet is exactly what it says and in the exact dose. So I think that's really important. But the bit about supplements or other things like that you can buy on various health sites and that sort of thing, I guess can be fine if people are into that. But you've got to really understand what's the benefit from it. And it's not in lieu of treatments that have been sanctioned or discussed with your doctors, or even have got research that's in the NICE guidelines or the National Institute of Health and Clinical Excellence.
Exactly, and sometimes we also help people think about how those supplements are going to interact with the medication they're already
That's true.
taking.
That's true.
So I would always recommend to talk to your responsible clinician or doctor, and really have a think about, am I going to take something that is going to affect the absorption of the medication that was prescribed to me?
That's really good advice. Yeah, I'd exactly agree with that.
I think historically we had quite a negative outlook, especially in the general public.
Yeah, so people feel that you can't treat schizophrenia or psychosis. It's like untreatable. So what's the point?
But actually, we know that you can recover from psychosis. You can get therapy. You can get medication.
So what about people around you, a supportive network. How important is that?
Isolation and not doing activities often doesn't help the illness, but can make it worse. So anyone experiencing psychosis and schizophrenia should really try and uh, connect and look for support networks.
But what I'd say is people around you, sometimes your family might be the best routes, friends that you connect with, or finding hobbies, and you might find people through that. But some people find it really difficult to connect out in the real world, and so there are various organizations that can help locally. The Hearing Voices Network is a really good one that I know some of my patients have used, so that's one that you can try, but there are loads of others depending where you live in the country.
And tell me, because quite a few of my patients are often scared that psychiatrists like you are gonna inject them and give them medications against their will. Well, that's not my experience of working with you. So I wonder if you could explain a little bit about, what medications you use for psychosis.
Well, to be perfectly honest, I can't say that'll never happen, but what I would say is we never start with it.
Mm-hmm.
So medication, as you said before, is a really important part of treating psychosis and subsequently schizophrenia if that becomes the condition. We tend to use medication of a class called antipsychotics, and we'd start with a low dose, and it's usually a tablet form, sometimes it's a liquid form, and we'd find one that might work best for you. They often will have side effects, and the idea is that the positive effects or the amount that they reduce the symptoms that are distressing you outweighs any of the side effects.
Yeah, and actually medication, we work very closely in the NHS, and medications often can help with therapy as well. And they can give the patient that kind of clarity and space from their beliefs or these really odd experiences that um, they're having, to be able to actually sit in a room and talk about what's going on for them.
Yeah, and I see it as also giving you confidence
Mm-hmm.
to be able to speak to the therapist. Because I think that can be quite important. It can be quite a daunting thing to sort of lay your thoughts, your intimate thoughts and worries with a person you think might judge you.
Yeah. And there are different types of therapy. Normally, kind of the National Institute of Clinical Excellence in the UK recommends CBT as the gold standard for the treatment of psychosis.
So, yeah.
And that's a type of therapy that helps the person really make sense of their experiences and reduce their distress, but also understand what psychological processes are leading them to having these unusual experiences. I work as a cognitive behavioral therapist, specifically with people experiencing psychosis, and there's other types of therapies as well.
Yeah, like systemic therapy, I suppose.
Yes, absolutely, and that's why we often offer something called family intervention, which is a specific type of therapy that trying to helps the family and the relatives of someone experiencing psychosis make sense of what's going on, but also react in a way that doesn't escalate emotions,
Yeah.
and instead helps cool down the temperature
Okay.
in the household.
So the best chance of treatment, if I get you right, is the best chance of success is really to come forward for treatment as soon as you get some of those symptoms. Is that fair?
Absolutely. And as soon as you have those symptoms, you should go to your GP or talk to a medical professional, and really try and understand what's going on for you and what the potential treatment options are.
Psychosis, you said, could be treated relatively successful if you get there early. So that
Mhm.
sounds quite hopeful. What about something like schizophrenia?
So we can still help people manage and live with schizophrenia and have successful lives and live a life with with good, what we call quality of life. But it's really important that that the patient or the young person seeks help. And it's all about how we treat it and how people take care of themselves. It's about engaging with psychological treatment, engaging with a psychiatrist, and maintaining your physical health. For more information on psychosis and schizophrenia, go to the Best For You website.
Or if you prefer to chat, then send the word NATTER to 85258 or call 111 option 2.